patient still hasn't shown up. She probably drank too much last night. I'm pacing by the waiting room, trying to get through. Can't even get a signal. What am I to do? Type of dawn. Call upon ya. I finally get a reply. I'm still hoping she'll come in. I read the text message. She's flaking again. I think I'm gonna call her to tell her what's up. Let Mrs. Ludwig do that because she's so damn tough. Type of dawn. Call upon ya. Unless my patient shows, might have to go on strike. Gonna tell her off. I'm just kidding, psych. 70%, here we come. Deep in her mouth, zero stole me up. Howdy y'all, Greg Brooks here. Now let me just tell you about my patient that didn't show up today. Again. She just happens to be on exactly 10 medications. But we're going to talk about 5 of them. So the first drug we're going to talk about is a Category B heparin type anticoagulant known as Fragmin. Picture. Boom. The generic name for this drug is dalteparin. It's used in the prevention of deep vein thrombosis following surgery, the treatment of unstable angina, and the prevention of blood clotting in patients on aspirin therapy. Now, if I had a patient with this, which I do, I would delay any elective dental treatment until anticoagulant therapy is completed. Yep. I would probably consider local hemostasis measures just to minimize bleeding. Duh. I mean, come on, who wouldn't do that? And I would avoid prescribing any aspirin-containing products. This drug is a Category D anticonvulsant known as Tegretol. Picture. Generic name for this is carbamazepine. Say that 10 times real fast with a dialect like mine. Carbamazepine. No, I ain't gonna do it. But I could. Okay. So, it's used in the treatment of various seizures. Also, it's used in the treatment of trigeminal neuralgia. Now, I bet some of you guys know somebody out there with trigeminal neuralgia. Maybe let them know about this. Put that up under your hat and keep it for later, okay? It's also used in the treatment of some psychotic disorders, diabetes insipidus, and alcohol withdrawal. Now, if you don't quit alcohol, you don't have to go through the withdrawals. Come on. How simple is that? Okay, so, easy stuff. You want to monitor their vital signs at every appointment. Dry mouth may occur, so you might want to offer some kind of fluoride regimen, saliva substitutes, maybe tell them to sleep with a cup of water next to their bed at night. That kind of deal, you know. You might want to find out the details of their epilepsy so you know how to treat it if something does occur. That's pretty much it for that. Next drug is a Category C antipsychotic known as Abilify. Let's get a picture up of this one. Okay. Generic name for this is aripiprazole. Not even going to try to say it 10 times. Maybe you can. It's used in the treatment of schizophrenia. Now, the treatment modifications for this are pretty simple, okay? You want to assess their motor functions, as extrapyramidal activity may complicate treatment. Also, you might want to consider the semi-supine position if GI side effects do occur. So this next drug, our 4th drug, is a Category C antihistamine known as Allegra. I bet you've heard of that one, right? Generic name for this is fexofenadine. Kind of fun to say, huh? Get a picture up of that one. Alright. It's used in the treatment of seasonal allergic rhinitis and chronic idiopathic urticaria, hives. Now, if you got a patient on this, it's pretty simple. Just consider the semi-supine position because GI side effects may occur. As the last drug here, it's a Class C synthetic corticosteroid known as Advair. Generic name for this is fluticasone propionate. It's used in the treatment and maintenance of asthma as prophylactic therapy. Also, it's used in patients requiring oral glucocorticoid therapy. If you have a patient on this, you want to examine their oral cavity for candidiasis because a fungus may occur. Also, you want to use caution when using vasopressor containing products because you may exacerbate the condition or cause an attack. Also, you might want to consider the semi-supine position. Also, manage stress and assess their salivary flow. If they got a dry mouth, you know the deal. Fluoride regimen, saliva substitutes, maybe tell them to sleep with a cup of water next to the side of their bed at night. Alright guys, that's it. I'm going to see you at Stagecoach or Coachella or something like that.
Well, it's 40 below and I don't